Fodor, a board-certified plastic surgeon in practice in Los Angeles and in Las Vegas. And I'm very excited to tell you about a totally miraculous procedure. And it has to do with reducing breast without scarring. And breasts are now that scarred. Has tremendous number of patients who have had breast reductions with very significant scars and need scar revisions, etc. But let me tell you about this procedure, and let me give you the talking points about as to who qualifies and what it takes. But first, I'd like to make a comment about how underutilized this procedure is. And I think there are two reasons for it. One, from the patient standpoint, the operation is not reimbursed by insurance companies. But as it turns out, the insurance companies don't reimburse regular reductions nowadays anymore either, unfortunately. And the other reason why it has not caught on the way it should have is that plastic surgeons and people doing liposuction in general don't feel comfortable doing this procedure because it requires very specialized techniques. These are the kind of techniques that will make the skin shrink. Because liposuction is done, skin is not reduced, but where does the skin go? Well, the skin shrinks towards the nipple. We call it not centrifugally, but centripetally, towards the center. And it's so much skin shrinkage that it's really amazing. So this results in a lift. So basically, this is a breast reduction and lift. Now, needless to say, younger patients who have more elastic skin, the better candidates. But we have done it in many, many patients in the middle age and later, and their skin still shrinks tremendously as long as very specialized liposuction techniques are employed to extract the fat. Now let's talk a little bit about the breast. Breast in general is an organ which is a skin organ, but it's composed of fatty tissue and glandular tissue. And so the only part that we can safely, without much bruising or swelling, reduce is the fatty tissue. So we need to figure out before surgery, because each patient is different, how much fatty tissue there is in their respective breast and how much glandular. And you don't want to get to the operating room and find that it's all glandular and you cannot do anything. Then you wake up the patient and say, geez, I'm sorry, it didn't work. So my contribution, I wasn't the one who discovered this procedure, but I contributed significantly to it. My main contribution was to recommend the mammogram, because with the mammogram, you can tell exactly how much fatty tissue there is and what percentage is glandular. And as long as at least 50% is fatty, you can do theoretically 50% reduction. However, many times the breasts are 70-80% fatty. So we do a mammogram on everybody. The next thing I want to tell you that as far as the skin reduction goes, this technique encourages the shrinkage to a point where the breasts reshape themselves and they kind of go up on the chest wall and does look really like a lift. Even in middle-aged patients, I have had patients on whom the areolar nipple, call it areolar nipple complex, has elevated by measurements that we take before surgery and after surgery as much as 6 inches. It's a miracle. It's truly, truly a miracle. And we have this, of course, photographically documented. But the other advantage of the procedure is that now the fatty tissue is removed and the suction itself creates some internal scarring. There's no scarring on the outside. It's a tiny incision under the fold. It's barely visible. It heals very well. But the inside scarring helps holding the breast up. So as the years go on subsequently, the breasts don't fall more as they could have fallen from gravity. And we have this documented because patients come back after breast reduction with liposuction years later for something like a facelift. So we get a chance to get some photographs and we can show how the breast remains in the position that we left it initially after the surgery. Now again, just in summary, insurance company doesn't pay for it, but they don't pay for reductions very much anymore. It's a miraculous procedure. We do a mammogram in everybody. The recovery in my practice, and I can only speak about my practice, and though I've done hundreds of this, is very little bruising, no pain, and patients are back to activity very, very quickly. We have them very supportive brassiere, which encourages skin shrinkage also. I hope that you had fun listening to this and be introduced to, again, what I call a totally miraculous procedure. And thank you for the time you've taken to look at this video.